How does for the elderly care space, mental health should be talked about parallelly, and as you are living your life, probably, but there's more isolation,
Yeah.
loneliness, which comes up. So how does mental health and care work together through that same services portfolio?
Look, when it comes to Umbrella Social Support Group, they're making a huge impact. I don't know how many times I heard from clients that, Henny, I would not be here without Umbrella. And that's just because we pick them up, come together, they can talk in their language, they can be with their friends, and then go home. And we're making sure that during that time, they get at least one good meal. We're looking at, but we know that isolation is a huge issue. We also have the HK Volunteer Visitor Scheme that sends bilingual staff to visit elderly who have been identified as being isolated. Residential care or at home. And we definitely can see that. But the problem is that the aged care system itself is pushing more to the health medical side of things. I don't know through how many channels, we keep advocating that the best prevention is the social connectedness. Even into the Sustainable Healthcare Review, which is the WA document, they identified that social prescription is one of the most important prevention. Yet we still establishing hubs based on medical needs rather than what does the person need socially, what does the person need to feel. When we feel valued, when we feel like we're giving back, when we feel like we are loved, that's when we can live a healthier life and strengthen ourselves against mental health issues and physical health issues. There's just so many positive review and research into social interactions, yet not even the new system acknowledging that. We actually wanted to put social groups into the highest category, but it's paid by the government fully, so the person doesn't have to get, because they're paying fully for nursing and clinical care. You're not going to prevent clinical issues with clinical intervention. You're going to prevent it by social prescription of connectedness and making sure that the person is well connected. And we have even our projects like the Multicultural Village have proven that people's mental health are improved, people's connectedness to their community improved. They know now how to search for help. This is not empowerment. This is how it should look like, but we still have this idea, and this came up in many conversations for the last 5 years, that aged care is moving to more medical. While we're having less nursing homes, or the nursing homes are more like a hospital, that's actually flowing an effect to the home care. So now, whilst it's good to keep people in their homes, we're not going to keep people in their homes with gardening, cleaning, or nursing. We're going to keep them at home when they feel like they belong, they're valued and loved. And that is still, for some absolutely unknown reason, no-go zone when it comes to policy in the industry. And I really hope I will see the change one day in my lifetime when we actually value these services more than clinical.